So hello everyone, today we are going to discuss about the external features of heart. In external features of heart, we will discuss about the surfaces of heart and the borders of heart. We will take each topic in details. So let's see the external features of heart. In external features of heart, there are surfaces and borders. In surfaces, we can see one is sternocostal surface, also known as anterior surface. Next one is diaphragmatic surface. The next one is base or posterior surface. Next is left, and last one is right surface. Okay. So there are four borders of heart. First one is upper border, next is right border, next is inferior border, and last one is left border. We will see each surface and border in details. Let's continue. The first one is sternocostal surface. Sternocostal surface, which is also known as anterior surface. I want to show you this sternocostal surface or anterior surface here in this picture. First of all, it is mainly formed by right atrium and right ventricle. This is your right ventricle and this is your right atrium. This is mainly your main portion of sternocostal surface or anterior portion of sternocostal surface, which is formed by right atrium and right ventricle. It is also partly formed by right auricle and left ventricle. Left auricle and left ventricle. This is your left auricle and it is your left ventricle. So, to sum up, sternocostal surface is formed by left auricle, left ventricle, right atrium and right ventricle. Right atrioventricular sulcus is also present. This is the right side, this is the left side. So right AV groove or right atrioventricular sulcus is present on the sternocostal surface. Right atrioventricular sulcus is present on sternocostal surface. Anterior interventricular groove. This is interventricular groove. The groove which is present between two ventricles. This is right ventricle, this is left ventricle. Groove which is present between two ventricles. दो ventricles के बीच में जो groove है उसको कहा जाएगा interventricular groove. So it is present on sternocostal surface or anterior surface. The next important thing is that 2/3 of right ventricle and 1/3 of left ventricle. Majority is formed by the right ventricle and in minority we can see its left ventricle. I can show you here. It is right ventricle, this which is 2/3. 2/3 portion is formed by the right ventricle, while 1/3 portion is formed by your left ventricle. These are two figures you need to remember. So this is what we can see in sternocostal surface or anterior surface. It is the surface which is towards your ribs, and it is comprised of right atrium, right ventricle, a part of left auricle and left ventricle. Right AV groove or sulcus can be seen. Anterior interventricular groove can be seen. 2/3 of your right ventricle and 1/3 of your left ventricle is present or is a part of your sternocostal surface or anterior surface. Now let's move to the next topic. Next surface, that's diaphragmatic surface. The diaphragmatic surface, first of all, it is flat. Okay, it is the complete, this complete surface is diaphragmatic surface and it is flat. Okay, it is flat. It is directed downwards, forward and to the left. Your heart is present in this manner, which is directed towards the left side. So it is directed towards the left side. The thing is, it is downwards. I told you that it's left and downwards. So it is downward, left and forward. It's also like this. So forward, downwards and left side. Downwards, forward and left side. So this is the orientation of your heart. So diaphragmatic surface is also having the same orientation, that is downward, forward and left. It rests on central tendon of diaphragm. I told you in previous lecture that central tendon is formed by septum transversum, which also forms the fibrous pericardium of heart. So diaphragmatic surface of heart rests on the central tendon of the diaphragm. It is the point to be noted here. The next thing is 2/3 by left ventricle and 1/3 by right ventricle. Majority, as you can see, is formed by your left ventricle, while in minority we can see the right ventricle. While in the above subcostal or anterior surface, we was seeing this the opposite. 1/3 was formed by left ventricle and 2/3 was formed by right ventricle. So this is the point to remember. One groove can also be seen here, that is posterior interventricular groove. This is your posterior interventricular groove. These are two ventricles. This is left ventricle and this is right ventricle. The groove which is present between two ventricles is known as posterior interventricular groove. It gives space, or it comprises of posterior interventricular artery. Posterior interventricular artery, which we will discuss later in the blood supply of heart. Only ventricles are involved. Very, very, very important. This is the only surface in which only ventricles are involved. Here you can see it is the left ventricle and it is the right ventricle. Both the ventricles are the part of your diaphragmatic surface, which is very interesting. So let's sum up the diaphragmatic surface. First of all, it is flat, it is directed downwards, forwards and to the left. It rests on central tendon of your diaphragm, so it is known as diaphragmatic surface. It rests on your central tendon of diaphragm, so this word comes from diaphragmatic surface. 2/3 by your left ventricle and 1/3 by your right ventricle. Posterior interventricular groove is seen here, in which posterior interventricular artery is present, and the last thing to remember is only ventricles are involved. We can see both right and left ventricles are forming your diaphragmatic surface. Let's move to next surface. Your next surface is your right surface. Next surface is your right surface. Right surface is formed by the right wall of right atrium. As its name suggests, this is your right atrium. The wall of right atrium is also known as sulcus terminalis. So right surface is related to sulcus terminalis, which is the part of right atrium. Here we can see the right surface is formed by the wall of the right atrium, which is also known as sulcus terminalis. Sulcus terminalis begins from the opening of IVC to the opening of SVC, which is present posteriorly, which can't be seen in this image. So the portion of right atria which is present from the opening of SVC and IVC, it is known as sulcus terminalis. So thing to remember about right surface is it is formed by the wall of a right atrium and it is related to sulcus terminalis. Let's move to the next surface. The next surface is your left surface. Here you can see that left surface is formed by greater part is formed by the left ventricle. This is your heart, this is your right side, this is your left side, this is your left lung, as you can see, and this is your left ventricle. So the left surface, greater part is formed by your left ventricle. This is your left surface. What is this? This is your left surface. So the greater part of the left surface is formed by your left ventricle. This is your left ventricle. The next thing is it is related to the mediastinal surface of the left lung. What is the mediastinal surface of any lung? The surface which is facing towards the mediastinum or towards the heart, it is known as mediastinal surface of that lung. So left surface is related to the mediastinal surface of your left lung. Is it clear? Okay. This is the left lung, it is the mediastinal surface which is towards the mediastinum. So it is related with the left surface of your heart. Now let's move to the next surface. Next is base or posterior surface. Base or posterior surface, it is also an important surface. What is so important about this? I will start from here. Both atria. It is the only surface, or it is the only region or which is formed by both the atria. Both atrias are forming this. It is not seen in any surface, any other surface except posterior or base surface. It is formed mainly by left atrium and partly by right atrium. The thing to note is that atrium and atrium, only atrium are present. So base or posterior surface is formed by left atrium and right atrium. What is this groove you can see between left atrium and right atrium? This is your interatrial groove. This is your interatrial groove. A faint groove you can see here, that's interatrial groove, which can be seen on the base or posterior surface of your heart. So what is the thing you need to remember about posterior or base? It is partly formed by left atrium or left ventricle. It shows faint interatrial groove, and the most important thing is only atria are forming this surface. That is, left and right atrium are forming this surface. So this is about your base or posterior surface. We are done with all the surfaces here, and we will quickly see all the borders. All the borders are covered in this one slide only. So we will focus on the borders one by one. Just we will compare this with this diagram. This diagram is very important, and it's a good diagram to compare all the surfaces to all the borders. So the first border we will see here is upper border. Upper border, it is formed mainly by left atrium and partly by the right. This is your upper border, which is present on the upper side. This is your upper border, partly by right atrium and partly by left atrium. Partly by right atrium, partly by left atrium. Separates the anterior surface from the base. It's important. Let's understand this. What is it saying? What is the anterior surface? I told you anterior surface is this surface. Okay. And the base is formed by the two atria, left and right atria. So basically what upper border is doing is separating this anterior surface from the base. So this point is clear. It's all about the upper border. The next thing is right border. Right border is formed only by the right atrium, extends from SVC to IVC. I already told you about the right border. This is the opening of superior vena cava, that is SVC, and on the posterior aspect we can see the opening of IVC, that is inferior vena cava. The line from the opening of SVC into right atria to the opening of IVC into the right atria, it is known as sulcus terminalis. It is known as sulcus terminalis. So right border is basically the sulcus terminalis. Okay, let me write here. Sulcus terminalis. So right border is your sulcus terminalis. Next one is your inferior border. Inferior border, first of all, I will show you. It's from the opening of IVC to the apex of your heart. Inferior border formed mainly by the right ventricle, separates sternocostal surface from diaphragmatic surface. What is this? This is your sternocostal surface. When you will move on your posterior aspect, then you will see diaphragmatic surface. So the line, the border which is separating your diaphragmatic surface from your sternocostal surface, it is your inferior border. So inferior border is extending from the opening of IVC into the right atrium to the apex, it is separating two surfaces. What are the two surfaces it is separating? It is a sternocostal surface and the next one is a diaphragmatic surface. Diaphragmatic surface and sternocostal surface. Left border, it is formed mainly by your left ventricle and partly by your left auricle. This is what we are seeing here is left auricle and this is your left ventricle. So all this surface comprising of your left auricle and left ventricle is your left border. I just said left surface, sorry. So this is your left border. So let's quickly recap all these borders. Upper border is this, you can see it is formed mainly by the right ventricle and the right auricle. Right ventricle left atrium and right atrium. Only this, left atrium and right atrium. The next one is your right border. Right border is mainly your sulcus terminalis, which is the opening of SVC and IVC in the opening in the right atrium. This is your right border. The next one is inferior border. Inferior border is extending from your opening of IVC into right atrium to your apex of the heart, and it is separating two surfaces, that is sternocostal surface and your diaphragmatic surface. The next and the last one is the left border. Left border is formed by your left auricle and your left ventricle. So this is all about the borders, and I guess we just completed all the borders and all the surfaces. So yeah, in borders and surfaces we discussed about the sternocostal or your anterior surface, your diaphragmatic surface, your right surface, your left surface, and posterior or base surface. And in borders we discussed about right border, left border, and right border, left border, upper border, and your inferior border. Inferior border is important because its extension is important. It is extending from the opening of IVC into right atrium to your apex, the apex of the heart. So this is all about the borders. The next and the important thing is the crux of heart. Crux of heart. What is the crux of heart and where it is present? Crux of heart is present on the posterior aspect of your heart. This is the posterior view of your heart. This is the posterior view of heart, and this point is the crux of your heart. Crux of your heart is basically the meeting point of few structure. What are these few structures? First of all, it is the interatrial groove. Interatrial groove, here you can see interatrial groove. Let me change the color. Okay, yeah, so this is the interatrial groove. Next is atrioventricular groove. This is your atrioventricular groove, and the last thing is posterior interventricular groove. We just discussed about this posterior interventricular groove. So these three structures, one is interatrial groove, this is atrioventricular groove, right and left atrioventricular groove, and the last one is interventricular groove or posterior interventricular groove. All these structures meet at this point, which is known as the crux of the heart. This is very important topic while we will discuss about the blood supply of heart. There we will discuss about its importance. So I just told you that this is the posterior interventricular groove, and here one artery runs which is known as posterior interventricular artery, which you need to remember. So we discussed crux of heart and we completed this topic also. And now let's move. What is next? I think it's done. Okay, yeah. So we completed all the topics of important topics related to the external features of heart. In external features of heart, we basically discussed about the borders of heart, surfaces of the heart. In surfaces, the important surfaces is the diaphragmatic surface and sternocostal surface, the base or posterior surface, right surface and left surface. And in borders, we discussed about right border, left border, upper border and inferior border. And after all discussing all these surfaces and borders, we come to the crux of the heart. Crux of the heart is the meeting point of three structures: interatrial groove, interventricular groove, left and right atrioventricular groove. This is known, the point is known as crux of the heart, and with this we complete the external features of heart. So thank you for watching, and please do subscribe my channel. Thank you.